Doctors always try to spend the least possible amount of time with you. Like, they cannot get out of that room fast.
Hi, dermatologist here. The original poster was talking about an experience that he had at a dermatology office where he got a skin check and then wanted a few other things addressed, and it seemed like his doctor was just like annoyed and trying to get out of the room. Firstly, I want to say to that poster, your experience and your feelings about it are totally valid. And it seems like you're based in the US, and I just want to explain some of the reasons why people feel like they don't get enough time with their doctors here. The first issue that we have is that there are not enough doctors. There's not enough of us, flat out. And when you're talking about specialists like dermatologists, there's like even less of us. So quite often we're seeing more and more and more patients because there's a need. The flip side of this is that capitalism has basically ruined medicine. There are different practice models that are out there. Some doctors work for big hospital systems, other ones work in private practices. And there are pros and cons to both, but hospitals can be for profit. They could be not for profit, but they still want profits. And a lot of the private groups out there now are either holding some sort of private equity investment or are flat out owned by one of those entities. So, in essence, the powers that be have a financial interest in us seeing as many patients as possible, and they push us to do that. In some dermatology practices, you're given 10 minutes with each patient. Now, don't get me wrong, there are some kind of visits that we could do in just 10 minutes, but the vast majority of stuff that patients are coming in with needs more time than that. The original poster said that he got 17 minutes total with his dermatologist, and I feel like that's a pretty good amount of time, sadly. The other issue here that I think maybe patients don't get is that this poster was talking about the fact that he went in for a skin cancer screening, for a mole check, and then he had several other questions about other things. In general, if you're going in for a screening exam, I would say, if you have like one or two things that you're wondering about, it's fine to ask those questions. But if you have a whole issue that needs to be addressed, say it's acne, hair loss, etc., people should have it in their minds that they're going to have to make a separate appointment for that. Because both skin cancer screening and like medical dermatology issues deserve enough time. The last thing I want to say here, however, is that this poster said that his doctor seemed annoyed. And I feel like as a physician, like it is important to not let your emotions get in the way of the doctor-patient relationship. Yes, a lot of us are strapped for time, but that's not our patient's fault. And I hope that people can see that if you want more time with your doctor and you're not getting it, it's not necessarily the doctor's fault. I think there are some big changes that need to happen within the healthcare system to provide more optimal care.